Today I am going to show you the repair of meniscus through all inside technique. This gentleman is the football player, have history of recurrent locking of the knee joint, and before we already advised surgery, but he was not willing to do that. But today, as we not able to make the complete extension of the knee, so now we have to go for the procedure. So now I am going to take you to the OT to show the details about the procedure. So today we are going to do the meniscus repair for this patient, and you can see that knee is in the flux positions. So this is locked in the flexion, and hopefully we will try to achieve the reduction of the meniscus. So on the MRI it looks like a buccal-handed tear. So now we have done the marking. This is the anterolateral portal, this is the medial one, and this is the tibial tuberosity. So we will start the procedure now for the meniscus repair. So after doing the diagnostic arthroscopy, you can see this is the lateral meniscus flipped and came inside the intercondylar notch, and now we are going to reduce this under the between the lateral femoral condyle. So now I'm going to push it, and you can see this. Now this lateral meniscus is in the place, and because of the lateral meniscus came in between the joint space in the notch, that's why patient is not able to extend the knee completely. And now after this, you can see this meniscus is in the good shape, and there is no such kind of tear. This looks like a meniscocapsular detachment. So we are going to do the repair through the all inside technique, and in between I'm just going to put the rasp under the surface of meniscus to allow for some bleeding, and so that it's going to be helping the healing. So, and this you can see in the posterior border of the meniscus, and just from the posterior to go for a little bit anterior, and just try to do gently, and after this, once it will be done, we'll see the some bleeding. And so now after putting the sleeve, you can put this device for the all inside technique, and I'm just going to put the one bite here, and it will be around 15 to 16 millimeter. So this is the first bite, and now you can take it out slowly, and this is the another bite. So now this knot has been completed, and now I'm going to pull this one, and you can see the reduction of the meniscus. And now I release the knot pusher. This is a very important step. Before cutting, you have to push the knot, and this is done now. And through this, I'm going to put one more, but before that, I'm going to change my portal, because as this one I'm seeing from the lateral portal, now I'm changing it to the medial portal, where I can see the posterior part of the meniscus very easily. You can see this, and now I am going to take the second suture. This is very easy technique if we are able to visualize clearly, and this is very stable, and the same technique we are going to follow here. And this is the second bite I took as before, and now I'm going to pull this the fiber tape, and the reduction will be achieved. And then you can see this knot is sliding, and now I'll push the knot with the knot pusher, and after that I'll cut this knot. So I think it looks more stable, but still I'll go for one more stitch on the posterior aspect, so that it will be easy in terms of healing and stability. It will be more stable. So this is the third stitch near the posterior horn. This one is very safe procedure, so and you will feel more confident, and stability will be also very strong. So once I complete, I'll show you the stability of the meniscus, and in this then I'll cut the knot. So now you can see this, I put the 3 stitches and it looks stable, and now I'm going to check with the probe, and you can see this is very much stable. So this is done now, and thank you for watching.